Yes. Good evening, everyone. Listen, I want to tell you right away, I do not have good news to announce to you today. Unfortunately, in the past few days, we've seen an explosion in the number of cases. Today, the preliminary number is at over 3,700 cases, and the experts believe that the number of cases is going to continue increasing. And the number of hospitalizations is going to keep increasing as well, amongst others, because of the presence of the new variant, Omicron, which, according to experts, is more contagious, which means that people have more chance of catching it. It is easier to get it when you are in contact with another person. Therefore, experts believe that in the prediction, the hospitalizations will be increasing over the coming weeks. Of course, hospitalizations are the key. For a long time, it has been our greatest source of concern because our health network is already fragile. We have healthcare workers who, for 21 months now, are taking care of COVID patients as well as other patients that we might call regular patients. And this is adding up for almost 2 years now. So when we hear that the hospitalization rate is going to be increasing in a significant way over the upcoming days and weeks, well, that means that we must act. Of course, I understand that all Quebecers are tired. Everybody. I mean, me first. We are tired of this. But unfortunately, I need you. We still have a battle to fight. I need you and I need everyone's effort. It's going to be very important. It's going to require courage, determination. After 21 months, it's hard, but we are going to be hit. For sure, the fact that we are better vaccinated than elsewhere in the world is going to help us. But despite all that, we will be hit. And that's important. Everybody has to understand. The experts, and not only experts, I mean, we have numbers every day to prove this, that unvaccinated people have 15 more chances of catching the virus as people who are vaccinated, 15 times more. So that is proven. It is scientific. And we can see it in the field. However, although vaccinated people have less chances of ending up at hospital, there still are risks. And of course, when we see the number of cases, which is now at 3,700 new cases per day today, well, it's pretty easy to understand that there is an impact and that there will be an impact on the hospitalization rates. The other thing that experts are now confirming to us is that the third dose helps to reduce the risk of catching the virus and having consequences that bring people to go to the hospital. So it becomes an important key, having a third dose. And later on, Christian will be talking to you about it, but it is important to respect the order according to everyone's risk. Because, of course, everybody will understand that, and we've seen it since the beginning, people who are older are at higher risk of encountering serious consequences. So it is important to vaccinate them first. So right now we are vaccinating all those people who are 60 and over in order for them to be able to get the third dose to protect them better. It is important to go get that third dose. It's also important to say that already the people who are in CHSLDs and in RPAs, they've already received their third dose. So the Minister for Health and his team are working very hard in order to accelerate this vaccination. And I hear people telling us, well, why don't you just open it up to everybody 18 and over? Well, if we did that tomorrow morning to anybody 18 and over, that would mean that we might end up in a situation where somebody who's 40 might get ahead of somebody who's 70, who is a lot more vulnerable and at greater risk. So just as we did the first dose last year, we want to go in order of risk. Therefore, we're going to be going gradually, starting in January, we'll be able to go to those who are not yet 60. And of course, the other important to vaccinate quickly is the healthcare staff. Right now, we have a healthcare network that is fragile. The last thing that we want is to take too much risk with the healthcare staff. So it's important, once again, to give the third dose to all the healthcare staff. Christian is transferring people, and it is true that in certain cases we might be looking like we're taking resources away from one area to put it to more. That's what it might look like, but yes, we're bringing staff to do vaccination, staff that was doing something else in the network, but the priority of all priorities right now truly is vaccination. And we've received 1,500 offers of people wanting to help us through Je Contribue. So we are right now sorting the people who have the skills to be able to vaccinate amongst those 105 people. But I invite all Quebecers who do have those skills, who are able to vaccinate, to go to the Je Contribue section site of Quebec.ca and to give your name. That is very important. Now, what has to be said is that in this fight that we're waging, it's not enough to just get vaccinated. The second weapon that we have is simple. We have to be able to reduce contacts, to be close to other people less often. And the objective that we're giving ourselves is to reduce contacts by 50% over the upcoming week. So today I'm announcing a certain number of measures that are going to be set as of Monday. So first, all businesses, we are going to be reducing capacity to 50%. In bars, restaurants, showrooms, theaters, we are also going to reduce capacity at 50%. In churches and places of worship, we're also going to reduce capacity to 50%. And the 50% won't be able to be more than 250 people, and we're going to be also setting up in churches and places of worship a vaccination passport in effect, such as is the case in restaurants. Now, there are activities that are at high risk that bring outbreaks, like karaoke, office parties, dancing. So as of Monday, those will also be forbidden. And since the beginning of the pandemic, we said that the last place that we want to close down are schools because it's important for children. So we don't want to close down the schools, and on top of it, it helps for the vaccination of children. So two good reasons in order to not close down the schools. So same thing. After the holidays, in primary school, the schools will open at the regular date. However, high schools, those who were supposed to start school again on the week of the 3rd of January, it'll be remote, but as of the 10th of January, it'll be in person in high schools. As far as CEGEPs and universities are concerned, there too, it'll be as of the 10th of January or later in the case where the planned upon date was later. As far as sports and outside activities are concerned, we're leaving all that open. However, and there have been problems, tournaments and competitions as of Monday are going to be forbidden. Now, the big question that people are wondering is, what are we going to do with gatherings in homes, in residences, including for the holiday period? Unfortunately, we must put a maximum of 10 people. So 10 people max in homes, in residences. even during the holiday period. And even 10 people, you have to be very prudent and just do what is absolutely necessary. There are risks in homes. First of all, it's important to say that airing out is important, to open, a window in the house, to have air circulation, and to be very, very prudent with vulnerable people. Vulnerable people, we have to keep a distance around them and to avoid taking risks. It's a question of judgment. There is a risk. And so we have to act consequently and be prudent, because I repeated, the Omicron variant is very easy to catch. So let's not take any risks. So our plan, we have two main elements, two things on which we have to concentrate. First, once it's your turn, go get your booster shot. And secondly, reduce the number of contacts, whether it be in your place of work, whether it be in your activities, when you go run errands, or whether it be in your own home, when there's other people in your home. We have to reduce contacts. And in order to be able to win this fight, I need you. The other thing that's really important as well, if you have symptoms that look like a cold or the flu, don't take a chance. Go get tested and stay at home in the meantime. As of Monday, there will be rapid tests that you will be able to do yourself, that will be available in pharmacies, so you'll be able to go get 5 tests per person. So if you have symptoms, if it's positive, well, go get a real PCR test and stay at home in quarantine. This is not the time when you have symptoms or when you've tested positive. It's not the time to see people. It's a question of respect for others. So just to end with, I know that Quebecers are tired of all this, but everybody has a role to play if we wish to win this fight and if we wish to get through it all. I know that there are people who are going to say, well, you change your mind. Listen, for 21 months, it goes up, it goes down, it goes up, it goes down. We have to follow it on a daily basis, and we have to act. We're not here, out of pride saying, well, I want to make sure that what I said a week or two ago is still the case today. No, what's important is to look coldly at the data when things go well, to say that things are going better and to give, some hope. But when things are going badly, well, to say that now we have to make some efforts. So since the beginning, for the past 21 months, Quebec has been one of the places where the measures have been amongst the strictest. We're going to continue doing that. We're going to continue ensuring that we react quickly. And we are going to leave pride aside. If there is one thing that we've learned with this crisis, is that we have to be very humble, because what we see today is perhaps not what we'll be seeing tomorrow or the following week. So I think that it is very important to react quickly, to adjust ourselves as we go along. So tonight, I am thinking of all Quebecers who are tired, who are looking forward to seeing their families. I'm thinking of business owners who've had 2 very hard years, who are saying, I was seeing the light at the end of the tunnel, and now I have to go back to 50% of my capacity. I understand that it's not easy, but I'm asking everyone to show courage, to take care of yourselves, to take care of those you care for, most particularly those amongst us who are vulnerable. So I count on you, and I thank you. And with those words, I give the mic to Christian, who's going to talk of vaccination. Thank you very much, François. Good evening, everyone. So just a few points. First, I would like to remind you that people 70 and over can have their 3rd dose, their booster. They've been able to since the 22nd of November. So up until a few days ago, we were below our capacity. That is today that we're not vaccinating at the max of what we could do. So it is time for people who are 70 and over to go get their doses very quickly. As the Premier has said, our priority are healthcare workers, to whom I reiterate, we have 20% of them who have been eligible for some time to go get their third dose. Now, on the interval, the good news is that, first of all, to take into account the epidemiological situation that we have right now, but also because of the arrival of the variant. Public health, our experts, are of the opinion that it is now preferable to reduce that interval to a minimum of 3 months. So that is a very big change. We're going from 6 to 3 months, and remember, just a few days ago, one of the reasons why we did not vaccinate as quickly was because we were limited by the 6 month. But with the arrival of the variant, public health has decided that it is better to reduce that interval. So we are going to be doing that. But it's pretty obvious with what we've seen in the statistics over the past few days that it was good to be able to reduce that. It's very relevant. Well, and now, of course, we have to adjust the calendar. So with that recommendation, there will be additional appointments available. Earlier, the Premier explained that we have 1,500 people who raised their hand to help us out, and of course our teams right now are readjusting all of our vaccination schedules. Just to give you one example, yesterday we vaccinated 53,000 people, so we've already started adjusting ourselves because we've seen since Monday that there was a need to increase the rates. So our teams are on that, which means that as of next Monday, Monday the 20th of December, people who are 65 and over will be able to make an appointment. That is Monday, the 20th of September. And as of Monday, the 27th of September, which is a week later, it'll be people 60 and over. And in parallel, we are going to be prioritizing our healthcare workers and the vulnerable people, people with asthma, etc. So if you are, for example, somebody who has asthma and who's 60, you can go get vaccinated. And I repeat, that means that all of our age groups after 60 are going to be, that's going to be open as of January. But since we have really good reaction from people who will help us vaccinate, I'd like to remind everybody younger that if we can accelerate vaccination even more, we'll do it. And you know, I told you, in a week we'll do 65 and over, and the following week. That means that between Christmas and New Year's, we should be able to have vaccinated people 60 and over. But if we can accelerate that, and the reaction that we've had from Quebecers and people who came to help us out at Je Contribue might allow us to go even more quickly, and that, I believe, is very important to say to everyone. Now, if there are perhaps other people who will come to help us, now I don't want to, get too much in detail, but just an hour ago we had a really great discussion where there are specialist doctors who are having a meeting tomorrow in order to be able to come and help us out. That is, and that's not in the 1,500 people that I was mentioning earlier on, but it really is, it is something that we're working on. It's a big, vaccination chore that we want to do, and we'll be able to do it very quickly, especially as we're working very hard right now, and the people who are going to come and help us out. And there's also the question of the flu vaccine. Our pharmacists, up until now, had been doing this. It's almost over. Yesterday, I was looking at our statistics. There were already 3,000 vaccines that had been done by pharmacists. So depending on the regions, that is also very good news. When I look at Je Contribue, people added themselves, and the specialists and pharmacists, and we're already at 50,000. Remember the number that Mr. Paré mentioned? Tuesday, it seems a lot further away, but it was only Tuesday. Well, I think that getting 800,000 per week is very, very possible, even in the short term. We've proven it already. Now, some regions are going to let us know. I don't want people to be surprised because we might not see one another as often over the next few days. At least I hope so. I'm sure that you do as well. But I want to reassure people there may be regions where things are going to go faster than others because we don't have the same vaccination situation. And sometimes if we were to open a category of 60 faster 1 week because we can, do not worry, we will go as quickly as we can through the age categories, as the Premier said, using risk categories. The last point, I also wish to reassure people who are in RPAs and CHSLDs. It's important because we saw in the first wave, the second wave, we improved. We keep improving, but our booster shots at 99% are finished in RPAs and CHSLDs. We've put a lot of emphasis right now because I'd like to remind you that this virus is very contagious. Remember, on Tuesday, we had indicated that we absolutely had to have mask wearing, for example, in common areas. I went to see my mother this week, and it's not good news to have that, but at the same time, I say it, we have to wear a mask. We have to be careful with physical distancing, particularly in common areas. Do be careful, because even if you get your third dose, even if you have the booster shot, you must be careful. The virus is still circulating. And we are asking, as we do, but we're going to be even more demanding, we're going to ask for a vaccination passport for all visitors and caregivers. I know that sometimes it's difficult, but I would like for visitors not to be shocked by this measure. Caregivers must understand that it's important to respect these measures, and the good news is that with rapid tests, we're also going to make our rapid tests available in RPAs and in CHSLDs. So to end with, we have to continue. Daniel Paris' team is doing excellent work, and we will keep you informed over the next few days for the vaccination categories for those not yet 60. Thank you, Christian. English?
We've seen a significant increase in COVID cases. More and more people are getting the new Omicron variant. Experts tell us this variant is much more contagious. They expect a significant increase in hospitalizations in the coming weeks. Vaccinated people are less likely to get sick, even with the variant. There's still a risk, but experts tell us we can reduce it with a third dose. The third dose is very important, but we need to prioritize vulnerable people and health workers. Our second weapon against the virus is to reduce our contacts. We need the help of all Quebecers to cut our contacts by half. On Monday, the capacity of stores, bars, and restaurants will be reduced by half. We'll also reduce the capacity of places of worship by half. Offices, parties, karaoke, and dancing will also be prohibited. For schools, wearing a mask will be mandatory in classrooms. Primary schools will reopen on the same date as planned, and secondary schools will reopen in person on January the 10th. We maintain outdoor activities and sports, but tournaments will be canceled starting next Monday. For private gatherings, we'll limit the number of people to 10, including for Christmas. We have to stay very careful, especially with vulnerable people. I also ask you to get tested as soon as you have symptoms. Starting next week, you'll be able to get 5 self-tests in pharmacies. If you're positive or if you have symptoms, please get tested and stay home. Everyone has a great responsibility. If everyone does their part, we can get through this together. I'm counting on you all. Thank you.
Merci beaucoup. Donc, on va débuter la période de questions. On va se limiter, s'il vous plaît, à une
Thank you. We will now start with the question period.
de Cogeco.
One question and one follow-up. Hello, all three of you. Up until almost yesterday, you were telling us that gatherings are important. It's a reward for those people who've made an effort and all that. We worked really hard to be able to get to where we're at. And today, you've chosen to talk at 6 p.m., I imagine, to be able to reach a maximum of people. How are you going to be able to sell this to people of going back to war, if you will? Well, listen, I think we have to say the truth to Quebecers. For a few days now, we've seen the number of cases almost double. We want to be able to continue caring for our people in the hospitals, and it's a balance of inconvenience. So right now, we have to take that very seriously. The situation is critical. It's not just in Quebec. It's the same thing in Ontario, in the United States, in Europe. We're no different from anybody else. Probably we'll be able to get through it a bit better because we're more vaccinated, but we do have to make efforts, and there's no miracles. The first thing is to get vaccinated, and the second thing that's most important is to reduce contact. So even 10 people in a home, we have to be prudent with those who are vulnerable because there's a real risk for people and our health network. In your long list of things that were announced today, there's a lot for business owners, bar owners, restaurant owners. They've already lost a lot of money. Will financial help also be there for them? Yes, certainly. The same programs that we used when we closed down stores and businesses will be there. We also spoke with the federal government that help would be available for individuals as well for those who are affected. But to answer the questions concerning businesses, those who are affected will get have access to the financial help program from the government of Quebec. Mr. Dubé, you were talking about CHSLDs. Why do you think that this, how can the experience of 2020 help you? What kind of measures, extra measures to avoid the havoc and the mayhem that took place? Well, there's many. The main one is a vaccination. Remember, I think that we are now very happy that, people are almost entirely vaccinated with a third dose. There's only a very small percentage left. Those are people who are very vulnerable. That is why we started with them. So that already is behind us. I wish to repeat that one of the big issues is everything having to do with the prevention and control of infections. So we are once again going to reiterate that these measures must be in place because even when you are vaccinated, even with a third dose, you still have to continue being careful. So every day, and I'm going to keep doing it over the next few days as well with our CEOs and those people who are responsible locally, we have to make sure that the protective measures and the infection control measures are followed. And I think that up until now, we have been able to avoid infections or major outbreaks. We've had very few cases, and that is why, despite, and I'll end on that, despite the discomfort, for example, wearing masks in common areas, I think that that is a minimum required to make sure that people are well protected. For those gatherings of 10 people, if you could do it over again, and I know that you look at the data coldly every day, but if you were to redo it, is there something that you would do differently? Because we could see that increase coming for a few weeks now. Would you have been more prudent? Well, you say that we could see that increase coming for a few weeks. I don't think that a few weeks ago somebody would have said there's going to be 3,700 cases per day in Quebec. We have to be realistic, and we can't be proud, we can't be vain, we have to be humble, and we have to look at that from one day to the next, because when you look since March 2020, it's been going up and down, and when it goes down, it's time to give hope and to encourage and to allow people to see one another. When it goes up, well, then you have to take the necessary measures. So we have to adjust ourselves almost on a daily basis. So I think that the decisions that we make have to be continuously adjusted, and we will continue to do so.
Actuellement, c'est difficile de se trouver des rendez-vous pour se faire dépister.
Right now, it's really difficult to find appointments to get screened. It takes many days to get results. What can be done to improve the situation? Well, there's two issues on screening. First of all, I'm very happy that people go get screened. That's what we're asking for. The first thing is, as I explained on Tuesday at the last press conference, we can't go get screened just to be able to go to a party, and maybe that is where people who should perhaps not be in those lineups if they don't have symptoms or they haven't been in contact with anybody. So, we have to repeat to people that you go get screened if you've been in contact with somebody or if you have symptoms. The good news is that with the arrival of the rapid test kits that are going to be made available, and we've even started doing that in wait lines, that was my second point. If there are people who don't have symptoms, who are in the wait lines, we give them a rapid test, and already we can tell them, come back a little bit later. We know that you, or somebody who had symptoms, I'm sorry. So we already know that you have symptoms, so go get tested. But of course, when we're at 3,700 and perhaps even more over the following days, of course there's an increase. But all Quebecers understand one thing. Up until now, we have kept a balance between the staff who was in our vaccination centers. We have to vaccinate. That is our priority. If it delays, if it means that there's a delay for the screening, well, I think that with what I just explained, we can also, come and balance that out with a rapid test. And the other thing is, je contribue. The last numbers that I got, 1,500 people, and I have a lot of people who can accompany people as well in waiting lines. It's not just vaccinators. So we're going to be redistributing in the screening centers people who can better manage those wait lines. As far as the capacity is concerned, ski centers and cottages. I'm sorry, what did you say? Is it going to affect those ski centers? Well, listen, we've always had the principle. The principle that we're announcing today is that we're saying that it's 50% everywhere. So we haven't made any specific measures just for ski centers, since it is an activity that I would say outside, but in a cottage as such, well, it's like a restaurant. So we have to have the same requirement, because we repeat, it is a question of contacts. If you can get 50% fewer contacts, well, there's a better chance that we're going to have a great deal fewer cases for the next few weeks, and that's what we have to do. Mr. Legault, last year at the same time, we were a few weeks from a curfew. We were confined. Right now, are those measures being excluded of lockdowns or curfew over the next few weeks, despite the situation? Well, listen, there's a difference, a huge difference with last year at the same date, and it's vaccination. However, you need a third doses. So now we are going to be accelerating the third dose. So we have to take that into account. But of course, it has to be reviewed every day and reevaluated. Right now, with the measures that we're announcing, we believe that that will be enough to get us through it. But it's not impossible that next week we are forced to adjust things. It's not impossible. But with the data that we have today, that is the information that is perhaps imperfect, but we believe that these are the measures that we've just announced that we have to follow. This is a press conference that feels a little bit like déjà vu, unfortunately. In the measures being taken into account, since we see the projections right now that don't look very good, are we planning on leaving anything aside in hospitals in terms of treatments? Right now, no. The good news is that we can continue with all of our activities. But if I had a choice to make, because perhaps that is a choice that we will have to make, perhaps certain activities will have to leave aside. I'm not talking about surgeries, I'm not talking about emergencies, but in certain activities, if I could not increase vaccination. But the good news, and I often say that we have to find good news, is the reaction of people on Je Contribue that could allow us to limit having to leave aside any medical activity. So leave us a few days, because tomorrow and the following day we're going to look at how we can go from 50,000 to 75,000 per day. But that I would like to be able to do it without having to put aside any treatments. Dr. Arruda, over the last few days, when we announced gatherings of 20 people, everybody sounded optimistic, but yet we could see what was coming up looking at Europe. Did you make a mistake? Last week, probably what I said was based on the epidemiology that we had observed here. I said that we're taking a calculated risk, and I mentioned that we could go up until 20, but that ideally we had to decrease it, and that's what we did. But now we have to understand that the situation has completely changed. Omicron is like a major change. We didn't know at that time to what extent it was going to be present. I'd like to remind you that Tuesday last, on the 7th of December, we tested many, and we had no variant. Right now we're at about 20% of Omicron cases as such. So did I make a mistake? Well, had I known today that we'd be announcing this, perhaps I would not have done it. But it was a calculated risk, an acceptable risk. And I wish to say that compared to many other provinces as well, that have maintained, 25 people gatherings and things like that, going up to 20 was judged by our experts as being a potential. And it's what I can answer. The pressure right now comes from the Omicron epidemiology, and I act on facts, on elements we can try to predict. And the hospital predictions were not at all the same as what we have right now with Omicron. Mr. Legault, you're nodding with your head. You agree with Mr. Ruda? He still has your trust? Totally. Listen, last week, as every Monday evening, we have a presentation from the INSPQ and the INES, and it totally changed this week. So, of course, as of the moment that predictions change, well, the announced measures change as well. And as I was saying earlier on, we have to be humble when faced with this. We can't try to say, through pride, I'm going to keep the opinion that I had a week ago. No, the numbers evolve so quickly that we have to adjust ourselves. And I would like to add that during my first press conference, I had said, what I say today will perhaps change tomorrow, because I knew that we were facing a beast that was going to bring us a lot of surprises. And if I could, Ms. Gauthier, just add one thing. We've heard a lot of comments from Quebecers for the past week on this subject, and I think that it is important to take advantage of being here this evening to say, yes, a Christmas party with 10 people is still possible, but not 5 parties with 10 people each. Perhaps, it doesn't seem appropriate to say that, but what we want and what our experts are telling us is that we have to limit contacts. So if we have one wish, and you want to have one Christmas evening, have one Christmas evening. Don't have 5 evenings with 10 people each. That's what we have to keep in mind. We have to limit the number of contacts during that period. So I just wanted to bring that clarification to make sure that everybody understood that.
J'ai une question à propos de l'efficacité des vaccins. Il y a 2 jours,
I have a question on the efficacy of the vaccines. 2 days ago, we were told that we have to learn to live with the virus, and now it's a bit like panic. Omicron, the increase of cases in Quebec, so we're wondering, despite all the efforts that have been deployed, are the vaccines as efficient as we believed after 6 months? Do they really protect us from the virus? And if so, why are we going back to measures that were set up before people were vaccinated? Perhaps going to vaccination, I'd like to tell you a little story. I'll do so quickly. Up until Monday, before getting the news on the Omicron variant, we knew that there was a loss of efficacy compared to Delta after about 6 months. So in that sense, our 3rd dose vaccination program was going as planned because we were in the 75-80% efficacy rate, and below that it was appropriate to get a 3rd dose. That was before Omicron. Now, Omicron arrives and it tells us now you still have protection with the former vaccines. That's still good news, except that this variant, and Dr. Horatio Ruda will tell you, it's gone down quite a bit because it's not the same vaccine for the same variant. And that is why we have to accelerate the 3rd dose. That has to be understood because it won't be perfectly, but it's better to go with 70%, rather than 30 compared to a non-vaccinated person who's at 0. So I just wanted to tell you that's what changed this week in a very excessively rapid way. So I just wanted to add that explanation. And I would also perhaps like to pass a message that is very important. Vaccination is our best weapon against this disease. It's important. People can't think that because you can catch the infection and transmit it, that the vaccine is no good. On the contrary, if right now we didn't have the vaccine, our hospitals would be completely overwhelmed and people would be in ICU. So it still remains very, very important. The first dose, the second dose, and the third dose following the order of priority. The other element, it's not because you add for, 4 months and a half and it, completely stops working. 6 months, it's optimal. I mean, I don't want people to think, oh, it's been 4 months, 5 months, and now it's going to be a catastrophe. No, it doesn't go down to zero. The issue with Omicron is that it is so transmissible, so very transmissible, that it's going to end up hitting people that don't have as good an immunity. And because of the fact that there's a lot of cases, there will be hospitalizations. But it is not comparable to what it would have been had we not had a vaccine. I mean, the proof is that if we didn't have vaccines, people in CHSLDs right now, we would be going through what we went through during the other waves again. So no, people can't think it hasn't brought me anything to get vaccinated. Yes, it has. Perhaps you'll get the disease, perhaps you'll transmit it to somebody, but you probably won't be hospitalized. So I don't want people to think that the vaccine hasn't given us anything. On the contrary, the vaccine is the solution. But with the Omicron variant and with time, we realized that we would need a third dose, particularly for those more vulnerable, the ones who are more at risk. Younger people between 18 and 25, in a majority, except for a few exceptions, won't end up in intensive care if they have COVID-19. They won't have many symptoms. And I find this very, very, very important. Get vaccinated. And for those who aren't, the best present that you can give yourself, because now things are being transmitted a lot, you're going to be exposed probably because there's a lot of cases, get vaccinated even for the first dose so you don't end up at the hospital and so you don't end up in ICU.
Toutes ces mesures-là entrent en vigueur, ou à peu près toutes, ce lundi.
All these measures are coming into effect on Monday, the 20th of September. And there's great events over the weekend. I'm thinking about the Cowboy Fringant show that is going to draw a lot of people at the Metropolis. And the Bell Center is in camera. But what about the shows happening everywhere in Quebec over the weekend? Well, we have discussions to have about that. I don't want to give you a specific answer here because we haven't gone over everything that is planned and we haven't debated about it. We acted quickly today in an exceptional way for the Bell Center. But with everything concerning amphitheaters and shows and all that, we're going to have a risk evaluation with the organizers, amongst others. So it could change for the weekend. That's what I understand. It's always possible. As I said, I don't know. I'm not going to get ahead of myself on something where I haven't been able to make an evaluation, but it's possible.
Monsieur Dubé, quand vous avez annoncé,
Mr. Dubé, when you announced gatherings for 20 people, you had also said at that time that there was no question of doing, for the police to check what was going on. You're not without knowing that most Quebecers probably have made plans for 20 people. What happens now with 10? Are you going to encourage police officers to go to private homes? I asked a question to you, Mr. Dubé, but it can be for Mr. Gauzois. Well, I'll answer. The answer is no. We said that we were basing ourselves and trusting the responsibility of Quebecers. We're not going to go inspect people's homes. I think that is why I reminded earlier on that Quebecers have reacted very well up until now. And I'll give you an example. Since we made the press conference on Tuesday, Quebecers have reacted very well. Some have even already decided to reduce their activities, whether it be, unfortunately, dinners at the restaurant. And I say unfortunately because it's unfortunate. It's the right decision to make, but it's unfortunate for restaurants. So we are going to trust the sense of responsibility of Quebecers, and that is why we said that it was a question of contacts. We're going to be relying on Quebecers. The day that Quebecers know that they have to reduce the number of contacts, they'll do it themselves out of a feeling of responsibility. As far as the Sûreté du Québec, That is to support business owners to make sure that they don't have any problems when they require the vaccination passport, whether it be in a restaurant or in a bar. And there will be, over the upcoming weeks, there's going to be checkups in bars and restaurants to make sure that people are respecting the requirement of the vaccination passport. I would also like to add, it's not a question of getting caught or not. When we look at the number of cases went from 1,000 to 3,700 per day, and experts believe that it will continue increasing. When we look at hospitalizations, in a very short amount of time, we went from 200 hospitalizations to 300 hospitalizations. So Quebecers have to think of themselves, their own health, and the health of the people they love, as well as the healthcare network, because we don't know who is going to need those services at some point, in a week or in 2 weeks. So it's not a question of are we going to get caught or not. There's a risk. And I ask Quebecers to use their judgment. There's a question of personal risk, there's a question of risk for their loved ones, and there's a question of solidarity as well in our people to be able to get through things and to care for all those people who need to have access to care. This will be a more specific question, taking into account that the showrooms are remaining open. I'm thinking about two things at the same time here. For example, in CHSLDs, most of them have rooms that are rented to be able to have their families over for opportunities like New Year's, Christmas. You're probably very aware of that. And at the same time, there's a lot of shows, concerts being planned where there are musicians who have to be able to rehearse, because you can reduce the number of people in a room, but we're not going to reduce the number of actors for a theater piece. So what are the guidelines planned specifically for artists, culture, and in CHSLDs, the rooms to be rented? Thank you for your question, because as far as CHSLDs are concerned and places like RPAs, there's all sorts of guidelines that will be addressed. Now we have reintroduced the masks in common areas, but the management of eating rooms and meeting rooms and all that, there will be specific guidelines on that. There will be certain constraints that will be added, and it will allow people to be able to live without exposing them to an important risk. So that will be done. The management of rooms. There will also be a whole series of elements in link with tests that will be added in CHSLD. So that will be managed. As far as the culture is concerned, there are protocols that are in place. We do not have the intention of preventing shows from taking place on stage. And the cultural sector has collaborated very well, whether it be orchestras and everything. By maintaining the distancing, there's a specific approach, so that will continue. What we're going to try to decrease in the present context are contacts between people. We also have to see that in showrooms, people are seated. Right now, they keep their masks. We're going to try to decrease how many people and distance. But these are places that are relatively safe still, the performing arts, if the guidelines are followed. Guidelines that we have here, but that don't necessarily exist elsewhere, and I want to say that. There may be people who will wonder, why don't we apply the same rules in one showroom or home or in a restaurant? Well, it has to be understood that there are places that are supervised with vaccination passports when you go in, which is not the case in people's homes. So you also have to keep that in mind when you compare a restaurant to a home.
Bonjour messieurs, Pascal Gachette du journal Métro. On se retrouvait en novembre 2020 avec un contrat moral qui avait été proposé.
In November 2020, we had a moral contract that had been proposed to Quebecers, which unfortunately was broken because of COVID, obviously. A year later, we have a half-broken promise now. How do you feel? How do you go through the fact that you are the one bringing bad news during a festive period? Well, listen, I'm not here to win a popularity contest. I am there to try to ensure the safety of Quebecers. When we ask Quebecers to make an effort, well, it's not to make me happy. It's to be able to avoid serious consequences for individuals and also to avoid that our hospitals get overwhelmed. We know that the situation is fragile, and I ask that we think about healthcare workers. I understand that the situation is evolving. When you look at the map in the evolution of cases, you see that there's been 4 waves, so there's been ups and downs, and we have to adjust ourselves continuously, and there's a lot of unknowns. There's a lot of information that's not perfect, but my responsibility as Premier is to act as soon as I have the information. If you allow me as doctor for public health, my role is to make sure to look at the epidemiology and to pose a diagnosis. I have to anticipate things, but I can't always know, just like a doctor needs certain exams to confirm whether something is cancer or not. And our role is to make the best decision at each moment that we make that decision to be able to save lives. Because our objective here is to save lives and to maintain a healthcare system, because there's also other diseases for which people need to be treated. So as the Premier was saying, you know, our pride, what we said yesterday and all that, that is not what motivates us. It really is the epidemiological portrait, and what we wish is to minimize that impact as much as possible for our Quebecers. About the administration of the third dose strategy, Mr. Dubé, we saw yesterday that the federal Minister for Health said that the third dose was essential, and after that Ontario launched their vaccination campaign for people 18 and over as of Monday, so for everyone as of Monday. What is preventing Quebec from doing the same thing and proposing it to everyone? Is it just the strategy or the vaccination capacity? No, it has nothing to do with the capacity for vaccination. Let us be very clear. Up until yesterday, or even this morning, we had a limit. We had to respect the 6-month interval. That was the main factor that prevented us from going more quickly for the vaccination, because up until now, we had people 70 and over, and even we didn't totally use our capacity. So that is the first thing. So when we got the new recommendation from public health that we could go to 3 months, well, that is where we readjusted ourselves. Now, for the order, I think that it is quite normal to have the same order that we've always followed over the past 2 years. We're starting to have experience with this, to start with our vulnerable clients. And as the Premier was saying, I don't think that it is acceptable for somebody who's 30 or 40 to get ahead of somebody who's vulnerable or a healthcare worker. So what we're doing with the dates, we have that experience now. The dates that I gave, for example, for people 60 and over or in the upcoming 2 weeks, if we can go more quickly, we will go more quickly and get to the 60 and under more quickly. But we have to be realistic. We have to finish all of our vulnerable people, people 60 and over, the healthcare workers, and then quickly go to the rest. But I'm telling you, we'll be communicating with others, with other people as soon as we have new dates. Mr. Minister, I'd like to add an important element. I think that it's important to say we compare ourselves a lot, and that's fine. We have no problems with that. But in Quebec, we made a decision to spread out the distance between the first and second dose at the beginning. Remember, we had gone up to 16 weeks. The studies have shown very well that the vaccination efficacy is better with longer intervals. Now it's 12 that is recommended, and that changes our epidemiology compared to other provinces who are starting the third dose earlier because they had given the second dose after 21 days, and we can't forget about that. So yes, we can compare from one place to another, but we also have to look at the context, the choice of programs that were set up, and the different epidemiology, and that is one of the factors that makes it that the question of the urgency of giving third dose before Omicron arrived was not the same. One last question in French. I was wondering, are you going to adjust the vaccination passport, taking into account that 2 doses is no longer a guarantee of an adequate protection? That will be discussed and evaluated as such, because we also have to make sure that we do not prevent access from certain things, but it will be looked at, yes. It won't be tomorrow morning. What's important for us right now is that people have their doses, that are elderly, 70 and over, have their doses, CHSLDs, and once we'll have enough and will be generalized, we can evaluate. But technically, it's very easy. On my phone today, I have my third dose, so it's very, very easy to get through because you get an update when you get the third dose. Yeah, as we did it last time. We can't require the vaccination passport when people have not yet had the opportunity to get vaccinated. Mr. Ruda, are we sure that the increase of cases is going to necessarily mean an increase in hospitalizations? Well, the relatively good news right now is that we observe a significant increase with a light increase in hospitalizations, but they're not going together. So we still have a dissociation. The cases are increasing and hospitalizations are as well, but not as quickly. The problem is that if the cases increase too much, well, because of the fact of quantities, you'll end up having an impact on hospitalizations. What we are targeting is to avoid that cases go up too quickly over a critical period as well, because January and February are months of respiratory infections, so those months are always more difficult for the healthcare network, so it's to make sure that it doesn't go up too much to be able to keep our system in functioning order. I do not believe that it'll come back like this, but it'll be pretty high according to the projections, high enough to concern us. But also they're healthcare workers because they can also get ill. And that is why we have to vaccinate them quickly, because there's a few that could get infected, by their children, for example.
Thank you. Good evening, gentlemen.
We will switch to English questions.
The first question is for Mr. Legault. You spoke about two weapons right now to try and curb this wave. One of them is to reduce contacts. Obviously, you want people to be 10 or less for their parties. Are you prepared now to at least tell Quebecers at home that a curfew is off the table between now and Christmas, or is this something you plan to review yet again? And if the cases do go up, if you have a number in mind, what might that number be for hospitalizations that would necessitate a curfew?
Yeah. The measures we announced today are the measure we think that will be enough to change the situation. Of course, the increase in the number of cases may change in the next few days, in the next few weeks, so we may have to adjust our measures, but today we don't have a plan to put again a curfew.
Okay, but you're not ruling out the possibility next week of...
With this pandemic, we cannot rule out anything.
Thank you. There's a question for Mr. Dubé as well regarding vaccinations. It's clear the Premier has identified the third dose, and a lot of health experts are saying that is very important right now. Can you give us a sense of how you really plan to ramp this up? I do understand you have a lot of pressures in different areas within the healthcare system, but can you clearly explain how you see this ramping up, and what perhaps dates into January, and can you forecast quickly where you see 50-year-olds and et cetera, how quickly you want to move on that?
Well, priority is clear, is health workers. It's very clear. We have a bit over 20% right now, and the good news is they can vaccinate themselves because they are within their hospital, so I think the priority will be there, and that should not slow down the effort that we have on the 70 years old and over. And the critical factor for us is really to get additional personnel to help us to make sure that we can vaccinate on the, as I said, on the lines of testing. I think Daniel Paré was telling me that given the good response that we just have received from Je Contribue, we could ramp up to our peak of June and July very, very quickly. Now that we have this new rules, we're not limited by the interval of 6 months, I think we can ramp up very quickly.
And one quick follow-up. How would you respond to perhaps some criticism that Quebec is not moving quick enough on the third dose, on vaccination?
Well, I explained twice that it's clear that we were limited by the interval. Now the interval is clear. We can go lower than 6 months. Capacity will not be an issue in the coming days.
Okay. Thank you.
Next question.
Good evening, Caitlin Thomas, Montreal Gazette. My first question is for Dr. Arruda. I'm wondering why you didn't anticipate Omicron hitting Quebec in this way after living through 4 waves of the virus and seeing what was happening in Ontario and other countries.
In fact, I would say that we knew it would come one day, but not necessarily at that level. And I can tell you that at the 7th of December, we made tests in our cases, and we didn't find any Omicron. And they already had found it in Ontario and in other provinces. But the curves are and the progression was even more than Delta. So it was difficult to predict exactly. And I would tell you that I always told that what I'm telling today was based on my epidemiology we're observing in Quebec, with our vaccination rates, with what the levels of protection that we measure. So we made that diagnosis at that moment, but having new data, we react as soon as the epidemiology was there.
Thank you. And my second question is for Mr. Dubé. A lot of infectious disease specialists and other experts in Montreal have been calling for 3rd doses for a while now. So I'm wondering why you waited until we hit almost 4,000 cases per day to ask for vaccinators to come help and to announce boosters for the whole population.
Well, I think I've explained that, but I'll repeat it. We had the capacity up to a few days ago to vaccinate more than 40,000 per day, and we didn't have enough people coming. So it's not an issue of capacity first. So I think that's the reason. First, we reiterate for the people that are 70 and over that have been, where the vaccination have been open since November 22nd to go and get their vaccine first. Second, we were limited. A lot of people remember in the last few conferences, I said the main difference is that we have an issue with people who wanted to get vaccinated, but they were not at the end of the interval of 6 months. We have received only this morning the okay to go below 6 months. And we always listen to those recommendations of public health. The minute we have, and we received that this morning, we are putting in place the vaccination to ramp up the capacity, and we'll go to the level that we had this summer.
Thank you.
Next question.
Hello, Andrew Brennan, CTV. The first question, I guess I'll, for you, Mr. Premier. Do you think that at this point, Quebecers are losing hope? And do you think that will make any difference when it comes to remembering where we were last year, having a possibility of an expanded holiday gatherings, having that ultimately be taken away like we're seeing again now? I know we have vaccinations on the table, and that's made things significantly better. All 3 of you have mentioned that today. But by this point, 21 months in, do you think we're losing hope? And do you think that there will be people that are not listening anymore, and will that make it harder to get the cases to go down again?
I can understand that some people are fed up of this situation after 21 months. But at least the vaccine is a good news. Of course, we need a 3rd dose. So that's something we didn't expect some time ago. But with the 3rd dose, our experts are telling us that we can face the situation. So it's a question of time. It may take weeks or a few months before everybody gets the 3rd dose. Of course, it's the Christmas, the holiday season, so people like to see their family. But we have to be careful. We have to be careful with this Omicron variant that we didn't know a couple weeks ago. It's very contagious, so we have to be careful, especially with vulnerable people, for some time until everybody get the 3rd dose. So I know that Quebecers, they have a lot of courage.
And I would say that the issue, we do understand that people are tired, but the problem is that virus is not tired. and it's coming back. And this is the problem, and it's the epidemiology who makes us take those decisions that we don't like. We would prefer to be in another situation, but the virus is still fighting us.
I'll take this opportunity to give you an example. Public health in the last few days has shut down a restaurant in Laval that had a party, a Christmas party, where 31 of the 32 guests were contaminated. That's the only thing I have to say.
Follow-up?
With that in mind, I want to ask about vaccine passports then for les lieux de culte, to have for religious gatherings and inside religious buildings. We have seen some congregations that have already been openly defiant against the gathering rules and public health ordinances, and they have had public health. They've dealt with public health, but how can we ensure that the vaccine passport will ultimately be used in these institutions? Because it's very, I imagine you can see the problem where the state inside a religious building may be necessarily a difficulty. Is there plans to enforce this particularly in religious buildings?
Well, I think that these people are responsible people. I've met last year with representatives of different religions, and they asked me if they can have the same rights as restaurants. They said, why we cannot have in place a passport and restaurants can't? So they ask for it. So I think that they are responsible people like the owners of restaurants, and I have confidence that they will respect the rules.
But there would be no, you said before that
like with restaurants. When you have to apply some rules, you can expect that some will come and check if you apply the rules.
Thank you.
And lastly, we'll go with Gloria Enriquez, Global News.
Good evening. If I understand correctly, it is the unvaccinated that are driving these new hospitalizations, right? And if so, what do you have to say to them?
Well, I know you're following those statistics a lot because you're always there at those point of press. Two things. We have right now probably half and half of unvaccinated and vaccinated. Unvaccinated, they represent about more than 50% of the cases, 50% of the hospitalization. But I would say 70 to 80% of the intensive care. That's a big difference. That's the first thing. The second thing, the vaccinated, even if they're double dose, they get a lot of protection with the Delta, but they lose protection over a number of months. And that's the reason, given the number of people that we have, when they lose the protection with time, that's the reason we need to have a third dose. And so right now, their probability of going to hospital and then to intensive care is very limited. So in summary, the non-vaccinated, they have 15 to 20% more chances to go to hospitalization.
And 15 times.
15 times the chance of a vaccinated, but their chance to go to intensive care is very high, So, and we're saying today, given this new Omicron variant, it's the time to maybe adjust your decision because you should get protection. We're going to be in this for the next few weeks. We know that. And I think that if there is a time to change your decision, it's the time to do it.
Perfect, thank you. And what do you say to restaurant and business owners who were counting on the holiday season to make up for the past few months that have been so hard for them?
Like I said, programs we've put in place will be in place again for the owners of restaurants to help them financially. So we will not let them alone. We'll help them. We'll be there to support them financially.
C'est ce qui met fin à la conférence de presse. Merci beaucoup.
Merci.
Merci tout le monde. Bonne soirée.
This puts an end to the press conference. Thank you very much.